Aripiprazole is a medication that is classified as an atypical antipsychotic. It is also called a second-generation antipsychotic. It is well known with its brand name, ABILIFY. This medication has a variety of clinical uses. It can be used in schizophrenia, bipolar mania, and depression. It has special uses in children. Aripiprazole is also available in various dosage forms, as a tablet, oral film, and solution. In this video, we will discuss key aspects of this medication, like how it works, how to take this medication, and what the important precautions and side effects are. First, let's start our discussion with its clinical uses. One of its uses is in the treatment of schizophrenia, which is one of the psychotic disorders. People with psychosis may have delusions. They are strong beliefs that are not really true. They can also have hallucinations, where they can hear a strange voice or can see unusual objects that are not existing. Disorganized thoughts, lack of motivation, lack of emotions, and withdrawal from social activities are the other symptoms of schizophrenia. For treating schizophrenia, aripiprazole can be given, which is an atypical antipsychotic with a less severe side effect profile compared with the first-generation antipsychotics. It can also be used for the treatment of bipolar I disorder. This is a mental condition where mood swings can be observed from mania to depression and depression to mania. Aripiprazole can control these mood swings, and it can also reduce the manic phase in the people. At a low dose, aripiprazole can also be used for the treatment of depression. Aripiprazole can also be used for other conditions in the children. In the children, it can be used for the treatment of autism. It is one of the neurological disorders that affects their behavior while interacting with other people. They may have difficulty understanding others and delay in speaking abilities. They may also have repetitive behaviors like rocking, spinning, and flapping hands. Aripiprazole modifies the activity of a few neurons in the brain, and it can control such abnormal behavior in children. This medication can also be given to children to treat another condition called Tourette's disorder. It involves sudden, repeated, and involuntary movements. They may produce few sounds commonly called tics. They may have blinking eye movements, jerking of arms, neck stretching, jaw movements, sniffing, and repeating words or phrases. Aripiprazole can be used to control these symptoms in children. How does it work? Aripiprazole is classified as an atypical antipsychotic. This medication works by multiple mechanisms, and it shows their unique actions. Normally in your brain, many of the chemicals are responsible for the induction of psychotic symptoms. Among them, dopamine is playing an important role. When these dopamine levels are elevated, particularly in the limbic and cortex areas of your brain, it may induce psychotic symptoms. In such conditions, aripiprazole can block these dopamine D2 receptors. However, it acts as a partial agonist. That means it can produce both blocking activity as well as stimulating activity. It also acts on the receptors for serotonin. One of its actions is as a partial agonist on 5-HT1A receptors. It also blocks 5-HT2 receptors present on the postsynaptic neurons. By all these actions, it can reduce the psychotic symptoms. In addition, aripiprazole can also block alpha receptors. Now let us see how to take this medication. Aripiprazole can be taken either with food or without food. It is available as normal tablets, oral disintegrating tablets, oral film, and solutions. When you take the tablets, never break, crush, or chew. It should be swallowed as a whole. In the case of an oral film, it can be placed on the tongue, where it is dissolved in the saliva, which can be swallowed without any need of water. But never chew the film and even never swallow the film. When you're taking oral disintegrating tablets, you should be more cautious while handling them. These oral disintegrating tablets are easily disintegrated and dissolved within the water. Therefore, they are delicate, and they should be handled with care. When you're taking the tablet out of the package, don't put any pressure on it, which may cause damage to the tablet. Handle these tablets with dry hands, as moisture can produce immediate dissolution of the tablet. Normally, these tablets can be placed on the tongue, where they are dissolved in the saliva. They can be taken without any water. However, if you require, take these tablets with a glass of water. As a tablet, it is available in different strengths, starting from 2 mg to 30 mg. As an oral disintegrating tablet, it is available at 2 strengths, 10 mg and 15 mg. For the treatment of schizophrenia, it can be started initially at a dose range of 10 to 15 mg per day. After 2 weeks of the treatment, the dose can be increased based on the clinical response. However, the maximum dose is 30 milligrams per day. In the case of bipolar mania, this medication can be given either alone or in combination. As monotherapy, it can be given as 15 milligrams per day initially. It can also be combined with other medications like lithium and valproate, where it is used as an adjunct. In such conditions, it can be given at a dose of 10 to 15 milligrams per day. For the treatment of major depressive disorder, aripiprazole should be given at a very low dose. It is started at a dose range of 2 to 5 milligrams per day. On a weekly basis, the dose can be increased based on the clinical response, but the maximum dose is 15 milligrams per day. For the treatment of autism, aripiprazole can be used in children with an age above 6 years. It can be started at a low dose, such as 2 milligrams per day, initially. In the case of Tourette's disorder, again it is initiated at 2 milligrams per day. After 2 days, the target dose can be increased to 5 milligrams per day in the children aged 6 to 18 years. However, in children with an age above 18 years, the target dose may be 10 milligrams per day, which can be achieved on the 8th day onwards. Now let's see the side effects of aripiprazole. Weight gain is one of the important side effects produced by aripiprazole. You may have sedation, dizziness, and lightheadedness. It can also produce a headache, increased agitation, insomnia, and anxiety. You may also experience blurred vision, dyspepsia, constipation, and difficulty swallowing. Few people may experience muscle pains. Akathisia, a state of restlessness, can also be observed in a few people. Other side effects like dry mouth and orthostatic hypotension can be observed. Effect on weight. Aripiprazole can produce few of the metabolic changes in your body, and it can increase the lipid levels, which may also lead to weight gain. So check your body weight regularly and try to avoid intake of high-calorie foods in case of weight gain. It can also increase your glucose levels, resulting in the hyperglycemia. This is more important in people with diabetes. If you have any symptoms of increased thirst, excessive urination, and weakness, it may indicate the development of hyperglycemia. Motor disturbances. Generally, antipsychotics block dopamine receptors in your brain. These dopamine receptors are essential for the functioning of motor activities. When they are blocked, it results in few motor disturbances, which are commonly known as extrapyramidal side effects. Aripiprazole is classified as an atypical antipsychotic. It is not acting as a full antagonist on the dopamine receptors. Therefore, it is less likely to produce serious extrapyramidal side effects compared with first-generation antipsychotics. However, you should be careful and check for any presence of motor disturbances with the use of aripiprazole. It may develop one condition called pseudo-Parkinsonism, an effect just like Parkinsonism that results in jerky muscle movements. However, it is reversible. That means it can disappear on stopping the use of aripiprazole. You may have acute dystonias that result in involuntary movements. They may be developed within a few days of treatment with this medication. However, you may notice these involuntary movements after several months, like after 6 months of therapy. This condition is called tardive dyskinesia. It is slowly observed after continuous therapy. In such conditions, you may discontinue the therapy. You may also have another condition called akathisia, which results in restlessness and a compulsion to move your legs. Orthostatic hypotension. Aripiprazole can drop your blood pressure when you change your posture. This condition is called postural hypotension or orthostatic hypotension. This drug blocks an adrenaline receptor called an alpha-1 receptor. These alpha-1 receptors are responsible for the contraction of your arteries, which builds pressure that is required to stand against the gravity. Aripiprazole blocks these alpha-1 adrenergic receptors. Thereby, it can reduce the blood pressure. Particularly, this drop in blood pressure can be observed when you change the posture, where the activity of alpha-1 receptors is highly essential. Therefore, you may observe few symptoms like dizziness, syncope, and hypotension. This orthostatic hypotension can be more pronounced when you're taking other medications that reduce your blood pressure. If you're taking benzodiazepines, they can increase the sedation and dizziness, and they can even increase the risk of postural hypertension. Benzodiazepines like lorazepam may increase the sedation as well as orthostatic hypotension if they are given with aripiprazole. Therefore, avoid lorazepam with aripiprazole. When you're taking aripiprazole with other antihypertensive agents, you should be cautious because it may increase the hypotensive effect, particularly when you change your posture. Aripiprazole can also produce somnolence and sleepiness in the people, which may also increase the risk of falls. Neuroleptic malignant syndrome. Another important precaution is the development of neuroleptic malignant syndrome. This is a condition that is involved with a few changes in the mental status. It may result in confusion, the development of fever, muscle rigidity, and even irregular heartbeats. Even though this is rare, many of these antipsychotics are associated with neuroleptic malignant syndrome. Effect on attention. This medication can impair your attention. It can inhibit the activity of your brain. Therefore, you may have a few symptoms like sleepiness, dizziness, and drowsiness. This effect can be more pronounced if you're taking other CNS depressants. Taking large amounts of alcohol may increase this effect. Therefore, be cautious in any activities that require more attention, especially during the early days. Aripiprazole can increase cardiovascular and cerebrovascular diseases. It may increase the risk of stroke in the people. In the people with previous cardiovascular disorders, this medication should be carefully given. Effect on blood counts. Few people may observe a condition called agranulocytosis with the use of aripiprazole. It results in leukopenia, reduced leaves of white blood cells, or reduction of neutrophils Leydig to neutropenia. This condition is more pronounced in people previously having less white blood cells, or any history of drug-induced leukopenia or neutropenia. When you're taking aripiprazole, particularly for longer periods, check your complete blood count regularly. In case you find your WBC count is less than 1,000 per microliter, then immediately you stop this drug, as it significantly indicates agranulocytosis. This medication is metabolized within the liver by two important enzymes, CYP3A4 and CYP2D6. Therefore, other medications can affect the levels of aripiprazole. Strong CYP3A4 inducers can reduce the levels of aripiprazole. Psychosis can also be developed due to many reasons. One of the reasons may be dementia in the elders. It is called dementia-related psychosis. In such conditions, you shouldn't use aripiprazole. It increases the risk of heart failure and the development of infections like pneumonia. It may also increase the risk of stroke and even death in such people. Abnormal thinking. Aripiprazole can produce abnormal thinking in the children, adolescents, and young adults with an age under 24 years. This is common with many of these antipsychotics and antidepressants. Therefore, carefully monitor any changes in the mood and behavior in such an age group. These are the key facts about aripiprazole that you should know for better understanding of its effects while using. That's all about this week's story. Thanks for watching this video, and if you find any interesting facts on this medication, please share them in the comment box below. Please do subscribe and hit the like button. I will come with another interesting video in the next week. Until then, have a nice time, take care, and goodbye.